I think the significant challenges are quite universal from what I hear in other developed countries. Of course, one of the big challenges is the availability of data. So, for example, we're very interested in the progression of disease because of the chronic disease and the complications and the sequelae of chronic disease that we see. So we have been working very hard now for about 10 to 15 years on building very strong collections of longitudinal records and mining those and building machine learning models to see how disease progresses and, for a particular patient who might have comorbidities, try to figure out what the most important thing to do for that particular patient is. So, and that also, by the way, helps us in cost management, the fact that we can build those predictive models. So I'd say data collection has been one of the big challenges. Other challenges include, I would say, making systems that are reliable and safe. So most of the systems we've been building advise the clinician, and we use quite advanced techniques there, including machine learning tools, generative AI tools, and of course we're playing with clinical key AI, and we're quite impressed by it. But where we have built systems and have deployed systems that directly interact with the patient, for example, they provide coaching to the patient about their lifestyles, they're taking their medications, or even help them in a kind of therapeutic manner on mental health matters. For those kinds of applications, we're much more careful. We're using more basic techniques. We're using, I'd say, rule-based techniques to a large extent, which are completely explainable. But we do hope in the future that we'll be able to use more generative AI techniques. Obviously we can use them today with clinicians, but when directly with patients, we're hoping that over time they will improve enough that we can even use the generative AI techniques directly with patients, which we're not really doing to much of an extent today. It's mostly to clinicians, and then, of course, the clinicians advise the patient.
Thank you. And it's a good segue into the AI and the generative AI field, I must say. And also, it's probably worth for our audience to know that you're in the process of finalizing a book. And it's quite a fascinating read. And the chapters that you've shared with us are really, really fascinating. And especially the one which is on the ethics, safety, regulation, and techniques to make AI safe. Grateful for some sort of light on that, because I think that is one of the biggest concerns people have about AI. The more the chatter always takes us to the ethical use of it, the meaningful use of it. So I would love to hear your thoughts on what the technology, the generative AI and the AI, what positive impact would they have on healthcare delivery?
Yeah. Well, they certainly have the potential to have a large amount of positive impact. One of the reasons for that is it's very well documented that the clinician is under tremendous cognitive overload. There's just so much information that they have to digest just in one patient encounter, whether it be, history, it might be images, labs, looking back in prior records for that particular patient to fully understand them. There's tremendous cognitive overload, not just for doctors, but also for most of the healthcare professions. And so that's one thing where there's huge opportunity to simplify that and to summarize that, etc., both prior to and during an encounter with a patient, but also afterwards in the preparation of, reports, referral letters, summaries, maybe insurance materials, etc. So we see an immediate potential there for the use of AI and, in fact, some of the generative AI tools. And, of course, they're under the supervision, if you like, of a clinician. We also see other great value in terms of how the clinician can deal with more complex issues, whether it involves treating or dealing with a less common disease or maybe recent introduction of a new drug, etc., where they can reach out and there's PubMed has over 1 million papers a year coming in. So how on earth, even within their subspecialty, can they keep up with that, right? So for them to get the latest information on new drugs, new treatment methods, etc., it's very powerful for them to have that as an extra tool and vehicle. The one thing that, of course, then has to be kept in mind is the safety. And there are safety issues. I mean, Gen AI is improving. It's improving rapidly, but it still has, potential for making mistakes. And we euphemistically refer to them as hallucinations. But the truth is it does interpolate and extrapolate between a lot of material. And from time to time, it can get things wrong. So it's quite important to have a huge focus on testing, red teaming, those tools, the technique called reinforcement learning with human feedback, which has been so far quite successful, but still not fully applied in tools to train them and make sure that they don't venture into spaces which they are not sure what they're doing or likely to make mistake. And then the last point comes back to the concept of, you could call it the dual dialogue. Today it's, I would say, reasonably safe for an AI, a generative AI, to inform and answer questions for a clinician, and for the clinician to filter that and apply that or even pass that information on to a patient. But where we start to use AI directly with patients, we do have to be much more careful. And there are documented instances of patients getting incorrect, misleading information. You could even call it misinformation from AI. And that's something that, obviously, from an ethical, the first principle in medical ethics is, of course, safety and patient safety. So the most critical thing is we guard against that. We can't stop that because patients will be using GPT, in fact, or common tools like Llama and the various tools that are out there. They will be using them. And so they'll be getting this. They'll be doing Google searches, for that matter. They'll be getting information. So they'll be doing that anyway. And so then the question is, particularly in the medical setting or where they think they're getting therapy, for example, mental health therapy, how do we protect them? How do even regulations might even be needed and required to protect people when they use those tools. That's why, in fact, I've been quite pleased to see in my few experiences so far in just testing out clinical key AI. I think I get the sense, and I understand from the background, and I also get the sense from using it that your colleagues have gone to a lot of trouble to use curated, credible materials, including guidelines and current guidelines to supplement. The literature is, of course, very useful, largely valid, but it does have outdated material. It has conflicting material. And so I think where you have extra high levels of curation of material and extra high levels of testing of the tools, then they become, of course, much safer for the clinician. And we're hoping that at some point they'll even be useful directly with the patient, but we're not quite there yet.